The Nutrition and Physical Activity Program at the Montana Department of Public Health and Human Services wants to make active living and healthy eating easier everywhere Montanans live, work, learn, and play.
So the Nutrition and Physical Activity Program is at the State Health Department here in Montana, and we're almost fully funded by the Centers for Disease Control. Our mission is to make active living and healthy eating easier everywhere that Montanans live, work, learn, and play. And that's just a way to reference, it's where we live, in our homes, in our neighborhoods, where we work, our work sites, learning environments, schools, universities, and play. So all our recreation areas, state parks, national parks, local parks. And I just want to acknowledge that we've taken a lot of these ways of framing up this conversation from Mark Fenton, who's a national public health planning person, an associate professor at Tufts University Friedman School of Nutrition and Science and Policy. And he also works for the Centers for Disease Control as a technical advisor, and we've had him out to Montana several times this year for the Obesity Summit in Missoula and for our very intensive work with local governments. So thanks to Mark. The points I want to make are just that the real epidemics are physical inactivity and poor nutrition. 7 out of every 10 deaths are caused by chronic diseases. And the biggest risk factors connected to those chronic diseases are tobacco use and physical inactivity. So 58% of Montana adults have at least one chronic disease. 59% of Montana adults are overweight or obese. And this is the real big ticket item. Over 75% of total healthcare costs are due to chronic diseases. So just think about that for a minute. And you'll hear in Hillary Hansen's piece here in a second from Riverstone Health in Yellowstone County, you'll hear her talk about how it's about making the healthy choice the easy choice.
First off, we have work that we're doing on making our roads safer for all users, whether you're walking, biking, driving, taking public transit, that you would feel safe using any modes of transportation. And the idea behind that is if we can make it safer for all modes of transportation, that people will start using alternative active transportation, thereby increasing their physical activity.
If you look at this graph, you can see just from the title, Changes in Walking and Cycling to School, 1969 to 2001, and you can see the source cited there. Back in 1969, look at that bar, the tallest bar, up over 40% of all kids between the ages of 5 and 18 were walking and cycling to school. Now look to the right there and look at how that bar on the far right has gone all the way down just above 10% in 2001. And this is the key point that I think is so important. It's about making increases in the routine, daily physical activity for everyone. So how do you engineer these activity-friendly communities? You get these varied destinations near residential clusters that people want to go and need to go, right? Work, grocery store, etc. And the network for active travel. So you get the sidewalks, you get the trails, the bike lanes, the quality transit options for people. And building designs that reward being active. Nearly 25% of all trips are a mile or less. And roughly 40% are 2 miles or less. So if you just think about how we're not likely to go to walk or bike or roll our wheelchairs or our baby carriages more than about 2 miles. So that is a really great argument for keeping development out of the perimeter as much as possible and keeping it in the center. There's 4 communities in Montana with adopted complete streets resolutions, and that's just one measure. The 4 are Helena, Billings, Bozeman, and Missoula. There's 6 more engaged and working on that right now. The 4 big dots, the 4 big green dots are the cities that have adopted complete streets resolution and are making investments in connectivity and all the things we just talked about. The 3 big other red dots also represent the cities over 10,000. So those are the big 7. The other orange ones are the other communities that are 4,000 people and up. So one of the things that we're working on in smaller communities are, and they're totally applicable in larger communities as well, are these joint use agreements. And they just are about sharing places for physical activity. And the 3 communities that we've worked with this year are Libby, Phillipsburg, and Miles City. The city of Libby and St. John's Hospital is working on an agreement to just get some better signage and connectivity between the new hospital facility in Libby and the Trails Network in Lincoln County and the city. And in Phillipsburg, great news there. The city councils acted, and the school district, to get an agreement about using the school playground and fields and the ice rink, and just putting up welcome signs, making it clear how those things are going to be maintained, making sure everybody feels welcome to use it, making sure everybody knows the hours. These are all ways that we know we can encourage routine daily physical activity for all ages and all abilities. So what do? There are 5 main things that we can all do, and they're around, number 1, master planning and zoning ordinances, updates for mixed use, open space conservation, that's all one piece. Secondly, complete streets guidelines and routine practice around designing for all users. The third thing is paying attention to transportation and trail networks, the connectivity that we talked about. Fourth is bicycle and transit infrastructure and incentives. So building in the incentives and looking at the transportation demand and managing that demand, figuring out where we can get the biggest bang for our buck and have the biggest reach and impact for making those transportation investments. And then the fifth thing is the Safe Routes to School program, and really continuing to invest in the Safe Routes to School program and using schools as a site for making these kinds of changes among our youngest populations. How can you help? We like to talk about just 3 main things. You can speak up, you can act up, and you can step up. How do you speak up, and why does that matter? If you talk to your family and friends and your neighbors and your workmates and students, if you're a teacher, media, community leaders, this builds a constituency for change, and investment follows. So, and then act up, just getting out there to help improve that built environment for walking and cycling and rolling, the walk, bike, and roll, and being attentive to that. And stepping up just as personal. It's about being an individual role model, building more activity into your day. These are the things that are going to change the way we live on our landscape and build physical activity and engineer it back into our lives and back into our communities.
If your community would like assistance creating environments that support physical activity and healthy eating, please contact us at mtnapa.com.